Last week I talked about one of the reasons why we have implemented a post-surgical aftercare program, which is for the detection and treatment of deep venous thrombosis and or pulmonary embolism. Let's talk a little bit about this particular risk that can occur after surgery. If a patient has had surgery, whether it's a spine surgery, an orthopedic surgery, a brain surgery, or any kind of surgery, they are at risk of the blood clotting. The blood or the body is responding to the stress of surgery by activating the clotting system. Also, patients are typically inactive during their surgery and they're less active after surgery. Prevention of blood clots in the lower extremities or in the legs is a very important thing after surgery. It's also very important to detect if a blood clot is present. So what do we do to prevent a blood clot, and what are the signs and symptoms of a blood clot? During surgery and after surgery, patients wear stockings on their legs and squeezy boots, or devices that squeeze the legs and help promote circulation. I'm using the term squeezy boots because that's what Dr. Brock says, and I really like the term. Additionally, sometimes patients will be placed on a blood thinner to help prevent DVT formation, especially if they've had a history of it. Finally, we encourage patients to get up and move and walk, and that is a great prevention. Signs and symptoms of deep venous thrombosis. The main sign or symptom is swelling of one of the legs. A clot can form in the vein and cause swelling. Also, leg pain can be another sign or symptom. If there's ever a concern for a deep venous thrombosis, we like to check an ultrasound of the leg to find out if there is a deep venous thrombosis. A clot in the leg can travel to the lung, and this is what is dangerous about a deep venous thrombosis. That is called a pulmonary embolism. Pulmonary embolisms can cause a sudden death in a patient after surgery. Any patient that is having difficulty with breathing or shortness of breath or chest pains after surgery should be evaluated for possibility of a pulmonary embolism. Treatment of pulmonary embolism and DVT typically involves anticoagulation. The most important thing is prevention and detection of these two conditions, and it's one thing that I definitely worry about in our patients that undergo surgery. Fortunately, the incidence is low. Most patients have no problems, but because of the significant impact on a patient's life that can occur, we all need to be diligent in our efforts to prevent and detect DVT and PE, or deep venous thrombosis, and pulmonary embolism.